Good morning, or good evening, or good afternoon, everyone, and a really warm welcome to today's Fireside Chat. I'm Fiona Costello, your eMHIC webinar MC. Thank you so much for joining us for part one of our two-part series, Digital Mental Health is Here, Ensuring the Quality of Care, hosted in partnership with the Agency for Integrated Care, AIC, in Singapore. 2025 has been a pivotal year for digital mental health transformation, with so many of eMHIC's member countries making big strides toward building a digitally enabled mental health ecosystem. I think we can all agree that the digital revolution has transformed mental health care, with major leaps in accessibility and innovative treatment approaches happening all the time. At the same time, though, these advancements bring important challenges. There's still work to do, setting clear standards for digital and non-digital services, protecting client confidentiality and data privacy, and ensuring quality care through effective measurement, strong data management, and digital tools that truly improve outcomes. Now more than ever, it's vital to take stock of these developments and chart a shared path forward. Today's fireside chat will focus on perspectives from the Asia Pacific and Middle East. We'll take a close look at Singapore, Australia, China, and the United Arab Emirates to understand how each country is integrating digital mental health into mainstream care. We're privileged to have a super-powered lineup of country leaders here with us today who will be sharing updates on progress in their respective countries. You will be hearing from our fantastic speakers shortly. It is a blockbuster lineup today. But first, a few housekeeping notes as usual. Feel free to share your current location or area of interest. To do so, you can click on the three dots next to your name tag, choose Edit, and add your country or area. This allows you to connect with others who share similar interests. If you have any questions for the panelists during the webinar, as usual, please feel free to post them in the Q&A box. During the Q&A session, I will do my best to include as many of them as possible in our discussion. And lastly, today's webinar is being recorded and the eMHIC team will soon share the recording in the Knowledge Bank. Now it's my pleasure to introduce our speakers. Their experience and work portfolios could easily fill the whole hour, so in the interest of time, I'll keep them brief. You can read more about them on the eMHIC webinar page. First and foremost, we have Chris Boyd-Skinner, Director of Clinical Governance at the Australian Digital Health Agency. Chris is a registered nurse with over 15 years of intensive care experience and now leads national and international clinical governance in digital health. He also advises the World Health Organization and is a founding member of the IEEE Alan Turing Institute Subcommittee on Ethical Assurance of Data-Driven Technologies for Mental Health. Next, we have Dr. Brian Hall, Professor of Global Public Health and Founding Director of the Center for Global Health Equity at NYU Shanghai. Brian was the inaugural Global Mental Health Fellow at the World Health Organization and co-developed cultural sections with ICD-11. He's helped design scalable digital mental health programs for diverse populations and leads research on migration, mental health, and health equity across Asia and beyond. Brian has also advised the WHO and Asian Development Bank on public mental health initiatives and currently serves as Editor-in-Chief of Epidemiology and Psychiatric Sciences. Dr. Anne-Claire Stoner, Assistant Professor and Global Mental Health Program Lead at Sing Health Duke, NUS Global Health Institute, Singapore. Anne-Claire is a public health physician with extensive experience in mental health policy and planning. She leads the Institute's global mental health workstream, building networks and platforms for knowledge sharing. She also ensures people with lived experience are central to designing and implementing policies, interventions, and training, collaborating closely with healthcare professionals, policymakers, researchers, and innovators across the region. As part of her GMH activities, she in particular coordinates the Asia Hub of the Mental Health Innovation Network. Dr. Kalu Al Sayeh, Head of Clinical Standards and Guidelines at Dubai Health Authority, UAE. Khulud is a distinguished healthcare leader with over 20 years of clinical and regulatory experience across Ireland, the USA, GCC, and UAE. She pioneers AI ethics in healthcare, sets excellence benchmarks for Dubai's public and private sectors, and serves on the UAE's National Committee for AI Regulation. She is also a multilingual speaker and recognized leader in transformative healthcare policy and governance. And finally, We have Dr. Weng Moi Tan, Director, Lead Integrated Health Promotion at the MOH Office for Healthcare Transformation, Singapore. Weng Moi is a pharmacist and healthcare leader with over 30 years of experience across clinical, community, and system level roles. She currently leads the development of healthy precincts and digital solutions to promote healthy living and mental well-being, and co-chairs Singapore's National Digital Mental Health Implementation Work Group. Previously, she directed national initiatives in caregiving and community mental health and has held senior leadership positions in both public and private healthcare. She is passionate about driving person centered, holistic, and sustainable models of care. First of all, before we get into the Q&A panel, what we will do is we will hear from each of our speakers for a couple of minutes, just to hear a little bit more about their work and to start stimulating our audience's thinking, so we can get lots of questions in this chat. But without further ado, I will hand over to Chris.
Very much. Thank you very much, Fiona. And it's an absolute pleasure to be presenting at this wonderful forum. I'm just getting my slides up and I'm hoping that everyone in the audience can see that. If I could just get an acknowledgement of that, we'll kick off.
Yep,
Perfect.
we can see.
I think a few hands raised means that that's a good thing. So, look, firstly, thank you, Fiona, and firstly, a huge congratulations to eMHIC for setting up this event. It's really great to be shining a light on the region. And while we might be geographically close, I think there's certainly a lot of merit in giving some time and space to share best practice, challenges, and those all important pockets of success. So, in the context of Australia, mental health is increasingly emerging as a really critical component of our modern healthcare system. And I think, particularly in response to rising demand for that accessible and also scalable mental health support. And for our country, the integration of digital tools into mainstream care is extremely important. And it's largely been driven by that commitment to quality, to safety, and also equity to access for digital mental health tools. And I think digital is a really important component of this whole piece. But this ideal is definitely not without its challenges, as we'll probably hear from a number of speakers on the session today. And increasingly, we are seeing a number of products and services that come to market that do pose some potential risk to service users. And there's a real call for shifting the regulatory approach to acknowledge these risks. So, in terms of framing digital mental health from Australia's perspective, our burden of disease is quite significant. Around about 8.5 million Australians aged between 16 to 85 have experienced some kind of mental health condition at some point in their life. What we're also seeing is, of course, that rising demand for digital tools. And this is largely off the back of significant workforce shortages, which I'm sure will be a key feature of other speakers' presentations today, but it's certainly very apparent here in Australia. And of course, also the rising cost of healthcare, that increasing mental health burden. Um, but interestingly, we are seeing quite a significant digitization of our national infrastructure, which is, I suppose, probably one of the most positive aspects in terms of digital health delivery here in Australia. A couple of key things to call out in terms of the regulatory approach context is we do have this balance of both hard and soft regulation here in Australia. In the context of soft regulation, we have a set of safety and quality standards, the National Safety and Quality Digital Mental Health Standards, which I'll speak to on the next slide. But they really have been quite significant in terms of turning the tide on improving the safety and quality of digital mental health service provision here in our country in Australia. What we're also seeing is some changes in relation to software as a medical device. And previously, under the Therapeutic Goods Act here in Australia, we had some carve outs or exemptions from the TG Act specifically for digital mental health technologies on account of those digital mental health standards. But what we're starting to see is this evolution of new products coming to the market, and likewise, a lack of clinical oversight and some some services or products really bordering on the periphery of being categorized as a medical device. And I do have a QR code there on the side of the screen if anyone is interested in reading a really great summary of a recent consultation that was undertaken by the TGA. This is by the legal firm Minter Ellison. So encourage those joining online to have a look at that and see what some of the recommendations from the consultation were really framed around. And also, I think like many other countries, we're seeing this real proliferation of mindfulness products that are being brought to market. And this calls into question some of their accuracy and also safety. And we're seeing some blurred lines, particularly in relation to data use and that third party on selling of data for people who sign up to these types of apps and products. And also, it also calls into question the variability of their effectiveness as being a solid mental health tool. I think also excitingly here in Australia, we're starting to see some real gains in the context of system interoperability. And we've got a very large health information exchange program at the moment as we move to modernising our health records with things like fire standards. And really, the benefit here for mental health patients or people who use mental health services is we have that clear line and transmission of data from clinical information system to clinical information system. And I think in the context of mental health service provision, what that allows is for a seamless exchange of data and also patients not having to retell their story if they move from one clinician to another. I think that's a really positive aspect. And within the standards, as you'll hear in a moment, we've got embedded an interoperability component which really outlines the sharing of the sharing of data from one system to another. So I've mentioned the standards a couple of times in this early preamble, but really they're quite a significant achievement both here in Australia, but also on a global level. This is the first set of safety and quality standards that we're aware of that specifically focus on digital mental health technologies. And they were born out of a need to put an assurance layer around a number of digital mental health products that were funded by the Australian government back in 2017. And really, the essence of these standards is to try and drive and support that safe and high quality provision of digital mental health services. They are targeted at the service levels. So I think what differentiates them from other sets of standards like DTAC and others that are used in Scandinavian countries is they're targeted at the service level and they really sort of look at the service from a holistic perspective. There's 59 actions across the entirety of the standards, and they focus on a couple of key themes. So, clinical governance, which is all around the roles and responsibilities of clinicians and board and executive within the service, to technical governance. So, we're looking at privacy, we're looking at health information security systems and cyber, also the partnering with consumers aspect, which is all around how we get that co-development and that co-design of services, and also that continuous cycle and iterative evaluation of service provision, and likewise the model of care. So how is the actual product delivering its care to consumers? If it's a CBT program, for example, how is that actually delivered? What are the escalation methodologies that are built into the product to ensure that if someone's at risk, we can refer them on to face-to-face care. And at the moment, we have 47 services that have been accredited to these standards. So I think we've really started to move the dial on ensuring that the majority of products in Australia are safe and fit for purpose. In and around this is some significant, I suppose, evolution of our My Health Record in modernisation, which is our national electronic health record. We're about to embark on a project which utilizes FHIR standards to enable that structured data sharing from one clinical information system to another. And this, of course, would in the future include digital mental health services. And I think, again, that data exchange nationwide will really add to a more seamless experience for mental health service users that are moving from service to service. And I'll finish with another really exciting announcement, which is our National Early Intervention Service. So the current government has invested 588.5 million over 8 years and 113 odd ongoing to provide a nationally available free low intensity cognitive behavior therapy service without a GP referral for those that have a mild to moderate mental health condition, which is starting in January 2026. So I think we're in a good place. New regulatory approaches are absolutely required to sort of address some of those outliers, but certainly we're heading in the right direction. And I look forward to hearing from my other colleagues and also engaging in the Q&A a little bit later in the session. So thank you, Fiona. Over to you.
Thanks so much, Chris. I definitely have questions, and I'm sure our audience will have questions. But before we go, I'd like to invite Dr. Brian Hall now to share a few words.
Okay. Can folks hear me and see the slides? Great. Okay, so first I'll start with people. I'm Brian Hall. Thanks for having me, and congratulations on the work. I'm really looking forward to sharing a few insights here from our work in China, and also to hearing from colleagues. First, I'll start with the collaborators. There's been a number of people that have worked with us over the years and continue to support the ongoing initiatives we have in digital mental health here in China and the region. Um, uh, Trying to get to the next. Hold on a second. Great. Okay, I want to situate our work in a broader framework. The Future for Mental Health in the Western Pacific is an undertaking that culminated in 2023 in a kind of agenda-setting framework for mental health in the Western Pacific. As a part of this effort, there was a great deal of discussion and talk around digitalization and digital mental health intervention across the Western Pacific. So I think we are at a moment where there is a tremendous amount of interest and support and activities around implementation and delivery of novel, innovative mental health services. To situate that within a broader health system context, of course, many of you are familiar with this WHO image that talks about the intensity of interventions. And really, digital mental health interventions have the promise of reaching people at the lower end of the cost spectrum, and with folks that have the highest burden of disease. And those are common mental disorders, principally depression and anxiety. COVID-19, we all know, was quite a catalyst for digital mental health. And very early on in the pandemic, we had conducted a scoping review looking at a number of different innovations that have come forward from the Western Pacific region, and we identified 174 interventions, unique interventions that were deployed in the post-pandemic context in the early phase. Many of them were digital interventions, and that has stimulated growth not only in the region but also then in China. The team, led by Jin Han, who was featured in our first slide, has done a systematic or scoping review on all the digital mental health interventions here in China, and looked at a number of key dimensions. Again, depression, anxiety being the principal focus, a lot of hotline use, websites, and an additional number of different trials have come forward as well. We did a similar exercise in Lancet Public Health, a team published last year, which really focuses on the increase in randomized control trials. So one of the major areas that we need to enhance, obviously, is the evidence base for treatments and evidence base for the effectiveness of digital interventions. And we still are encountering a number of key barriers in digital literacy, in geographic representation, where folks in higher income areas of China are getting digital trials and also digital interventions disproportionate to those in more rural and other contexts as well. And another key dimension here that was highlighted in the review that Jin Han had led, is looking at the lack of implementation and long-term scale-up of a lot of interventions. So we see that there's evidence coming out, there is strong evidence to support digital intervention, but there is an absence of implementation and long-term delivery of those services. In our Lancet Public Health article, we highlighted a process, an implementation process that can help to fill that gap. And we look at a number of key stages along the development of an innovation, including consultations with experts, developing the intervention and co-creating that intervention with stakeholders, piloting, and then conducting rigorous effectiveness and evaluation trials, which would then, of course, lead to sustained intervention development. and maintenance long term. We can motivate this through an example from our step-by-step program that we implemented here in China, which is a WHO intervention that is designed principally to address depression through behavioral activation. There are a number of different versions now that have been adapted and trialed in different parts of the world and have all shown great evidence of its effectiveness in across different contexts. But of course, in order to really deliver the digital intervention in a local context, we need to, of course, go through a rigorous process of cultural adaptation. We've written a lot about that, both in the articles that I've talked about, but generally in our work. And I won't go too much into that now, but I will highlight this effectiveness implementation strategy where we're really trying at this point, we know that digital interventions work. So we need to move beyond just doing efficacy studies in highly controlled contexts and moving into communities and into settings that we ultimately want to deliver these interventions. And a hybrid implementation research design allows us to take an intervention that we have some evidence and some confidence in its effectiveness and bring that into an implementation setting and test the implementation as a part of the outcome of the trial. We also think to highlight the importance of co-facilitation and co-creation, that people with lived and living experience should also be centered in this type of intervention, in addition to other types of intervention, including for people with serious mental illness. I think common mental disorders and digital interventions like this one that is ideally suited for folks that have common mental disorders, it should also center people's experiences in the creation of that intervention and also in its facilitation. We did run a randomized control trial using this kind of implementation framework in China and showed great evidence of its potential effectiveness. And this was embedded within a university system. We know that in terms of number of people with mental disorders in China, millions of young adults have common mental disorders here, and many more people than what the health system could possibly address. And because of that, we need to think outside the box and think innovatively about digital interventions, scalable interventions that can reach folks who are in need and embed those services where people live, work, play, and age. And I think the broader context of our thinking about social determinants also has a great bearing on our intervention frameworks, where we don't try to bring people into a space that they're not typically in, that instead we try to embed resources and services into contexts like university settings, like schools and workplaces where people can ultimately benefit the most. And I want to say, I started with people and I'll end with people. Digital interventions are not devoid of community. I think we could create a community and a community of practice, including on this great panel today and with all these wonderful folks that have decided to join us and really center all of you in the work going forward. So with that, I'll stop and say thank you very much again for inviting me to share this.
Thank you so much, Brian. That's super interesting. I'm looking forward to asking a bit more about that. Anne Claire, over to you.
Okay. Thank you, Fiona, and thank you, eMHIC, for the invitation to participate in this webinar. Yeah, good morning, good afternoon, good evening to everyone who is joining us today. So I would like to start this presentation by just saying that first, like digital mental health is a very broad and evolving topic and field. It comes from self-apps, and we talk about it, chatbots and virtual reality, encompasses online groups and websites, more disruptive digital mental health technologies such as digital phenotyping. And even more recently, we've been talking more and more about AI and generative AI chatbots and how it can play a role in supporting the mental health of the population. And the COVID pandemic, I think, Brian mentioned that earlier, really brought mental health to the forefront of the global discussions, and also sparked a surge of digital mental health solutions and startups and technology. And this comes with many benefits, especially for countries with scarce resources in terms of accessibility, affordability, scalability is stigma-free, can be crisis support, on time. So, but it also comes from quite a few limitations. And I would like to focus on one that I feel is important, is the inequities and digital divide. I think we need to ensure that those solutions don't widen the existing gaps. The gaps between those who have access to internet connection, who have access to technologies, who have like high level of digital literacy, and those who don't. So we need to make sure that those technologies reach out to the people who need it the most. And that's something that is sometimes a bit forgotten from the discussions. And if you look at the recent WHO mental health atlas that was just like published like last week, for the first time, the atlas include a question on like how telehealth services for mental health are available and being used in the countries. And the findings highlight that there are disparities by income. So only 21% of responding low-income countries had telehealth services available in their country, in contrast of like 82% of high-income countries. In Asia, the Southeast Asia region, the WHO region, reported like one of the highest proportion of like usage of telehealth services for mental health, with like 78%, I think, followed by the Western Pacific region. And in our landscape mapping, so our program, the Think Health US Global Health Institute, have been doing a mapping of mental health innovation in the region, not only like tech innovation, but it's not necessarily like a systematic innovation, but just to have a snapshot of like what's coming from the region in terms of mental health. And out of the 81 interventions that we included, 31 make use of technologies. And those technology or those like digital solutions come from like Nepal, mostly Singapore, Brunei, Philippines, Vietnam, and India. And almost like more than half of them were developed after the pandemic. What's encouraging that those interventions are not only like private driven solution, but they also come from the public and non-profit sector. And I just put some like case studies on the slide to showcase, like Thailand recently developed and launched a national digital mental health platform for the Thai population, supported by WHO, where they also like included like step by step. In India, there is a flagship national mental health program. It's called like Telemanas, that offers telemental health services for the population in like 20 languages. In Vietnam, there have been also like a initiative, to foster like workplace health and well-being to like workers in like factories. So there are many ways of like implementing and developing like digital mental health solution, and we've seen like quite a strong development in the region. I'd be very happy to discuss further during the discussion. Thanks.
Thanks, Anne-Claire. Dr. Khalud, your turn.
Can you see my slides?
We can, yeah.
Okay. So I'm here representing the United Arab Emirates, and it was great listening to the perspectives of other countries, and I realized that this is a global issue that is faced by everyone, and it's great to put in the UAE perspectives on how did we manage, because it's fairly new in the UAE in terms of a regulatory perspective and how we built up the mental health strategy. So apologies for this. So we all been suffering in silence when it comes to mental health globally. And we know that there is, with the COVID happening, there is a shortage when it comes to manpower. And that was one of the main reasons. So if you do have a mental disorder, or you have that depression, that anxiety, that feel of needing to speak to someone, there is shortage to reach to someone, or even a barrier of stigma in the UAE. To be labeled that you have some sort of mental disorder to reach for someone. So that was one of the main barriers. We're about 14% of mental disorders happening in the United Arab Emirates, with costing about 1 billion USD for affecting the productivity losses, and 9% of the Dalis lost in the mental health. The suicidal rate has increased by 2 times since the pandemic, among females in particular, physicians, and that was again added to the burden of the mental health disorders. So we came up with a big strategy called the Mental Wealth Strategy in the UAE, and we call it wealth because we felt like when it comes to mental, it's not just a normal health disorder. It's something that we would encourage people to have, to be proud of, to see it as a wealth and asset. And it's a comprehensive framework which was launched in 2024 and endorsed with a budget of almost $28.6 million US dollars. The initiative was aligned with our Dubai Fashion Agenda to make Dubai the world's best destination for living, working, and visiting. So this is for all in the UAE. The framework has 10 major initiatives, and these are some of the main initiatives that it came up with. Developing a comprehensive integrated care model. So we've always had a comprehensive approach to managing mental disorders or any other chronic disease. But we wanted that integrated model. So we have a health informatics system that connects all of the medical records together to have that comprehensive approach towards the patient and get the continuity of care. And we've also involved insurance to make sure that there is coverage when it comes to mental health disorders. We wanted to focus more on early detection and prevention program, and we did a lot of that using innovation and innovative approaches and encouraging awareness in the community. Increased services accessibility for health services. So we increased telehealth services in the pandemic. And at the moment, it's part of the hybrid approach in which all facilities in the UAE are mandated to have telehealth services. This is to improve accessibility in terms of having mental health disorders being accessible to physicians around the world, so that a physician that is residing outside the UAE can give advice to patients in the UAE and vice versa. We also wanted to strengthen the mental health education within the community, so we focused a lot in schools. So the mental health is now part of the curriculum in the schools, and it is encouraged in terms of the wellness activities so that kids in schools are free to speak about how they feel and if this is affecting my well-being or not. And therefore, hoping to reduce the level of stigma when it comes to mental disorders. A lot of promotion and research, especially around AI and mental health, that is encouraging in universities and in the health facilities. And we strengthened the governance and standards and infrastructure. So we've developed 2 standards last year on mental health disorder. One that focuses on the services and mandating. Other ones focusing on the scope of practices, finding the scope of practices when it comes to mental health. What's a psychiatrist's role? What's a psychologist's role? What's the health counselor role, and etc. I also wanted to highlight, in general, another strategy that's running at the moment, and is there until 2031 on artificial intelligence. So with that, it goes hand in hand with what's happening with the mental health strategy, because we are trying to build up an AI reputation destination within the UAE as well. So we've embedded AI education in all universities, all schools as a compulsory requirement. We've also channeled and encouraged applications and platforms that has both the marriage between AI and mental health to increase scalability and usage and reaching out to people that are in need outside the UAE and those that are in UAE that wanted a second opinion as well. And we ensured that there is an AI CEO in every facility to ensure that there is a proper awareness of education. It's not just enough to give in the innovation and the AI and say for everyone, this is a tool, use that to access mental health. It's very important to have enough awareness and understanding on how that AI works and what are the ethical principles behind it, so that when I start using AI for my mental well-being, I understand how it works. Especially when you're talking about younger generation who will start using AI and probably trusting that system too much. And if you think about it a little bit, step back and say, we're the one who actually fed that AI and told him what to say. You start questioning again, okay, how do I understand and take the advantage of it being, okay, an AI, a tool that will enhance my mental well-being, but at the same time, the ethical principles at the back of my mind, understanding that this is a tool and not something I can, 100% rely on. So we wanted to have that balance in the country by increasing more and more and more awareness. That's the end of my presentation. I kept it exactly 2 minutes so that we can have more discussions later on.
Thank you so much, and thank you for being exactly 2 minutes. Wengmoi, it's now your turn.
I don't seem to have the sharing right. Oh, okay. Okay.
Oh, there you
Can
go.
you see? Can you see?
Yes, we can see.
Okay. So, do you see that there?
Yep.
Okay. Yeah. Okay. Thank you. First, I'd like to thank eMHIC and Fiona for inviting me to share a little bit on our experience. We are very new in this area. Of course, in terms of building the basic infrastructure from digital mental health standpoint, Singapore government has done a great job in all the public health system. We have a very huge project on eMHR for the many years. And so they are kind of interconnected in terms of that. And it is also now allowing our family physician or general practitioners to be able to put input there as well. But in terms of really using AI, using a very different form of approach towards digital mental health, we're very new in this journey. So I'm from eMHIC. It's a small unit that's set up by the government in 2018. And we are looking into how we can do transformation using data, digital tools, to be able to co-create, as Brian said, right, bringing our partners together to co-create solutions. So we launched the National Mental Health and Wellbeing Strategy just in 2023, end of that. And of course, with the COVID, right, everybody else have the same problem. So the same in Singapore. So the government has decided to launch a National Mental Health Wellbeing Strategy where we look at how to further expand the capacity in the community. We started our community mental health services back in 2011. And so, as you can see, while it's 14 years on, we have built a lot of community mental health services, but it is quite a little bit fragmented. So a lot of people, when they give back during the focus group, feel that they don't know where to get help and who do they go to and things like that, right? And of course, in terms of bringing on our general practitioners, while we've been working on it since 27 when I was still in the Institute of Mental Health. But today we have about 2,000 odd general practitioners, of which about 1,000 are general partners, GP partners, so to speak, for mental health, but only about 200 are very actively involved. So one of the things now we are looking at is perhaps next year, how do we reach out to this general practitioner and get them to be on board the mental health, and digital mental health is one of the tools that can, as you can see here, to help them to be able to find where are the services, how do they then send the people for appropriate services. So the three strategy we use on is really how do we improve coordination, service coordination, so that there will be seamless referral. So one of the key things we are looking at is building perhaps a real AI kind of recommendation engine with an algorithm, translating the clinical protocol into workflow, embedding it into the various systems, be it by the community mental health partners or the general practitioners or the hospital, such that we could refer the cases. So we have also launched the tiering or step care approach in Singapore. And so right siting of care is one of the key things that we are trying to look at, because today, while I would say that our waiting time is not too bad, it's about 6 months, but that is still not acceptable, because when people need help, they need it then, right? Then the other part is, of course, we don't have that many mental health partners, especially clinical psychologists or psychiatrists or even community mental health partners. They're all a little bit stretched. So one of the key things we are looking at is how do we use augmenting the care with digital things like ICBT. So one of the things that we are now looking at is how do we validate the various form of CBT in the internet. And recently I learned from Scotland, even parent-led CBT for their kids as well. Finally, the third C where we're looking at is, of course, is self-care. And how do we democratize this? And so one of the things that we're now looking at, what is the governance and standard that we could put in place to ensure that the self-help tools are safe, because we know that there are 10, 20,000 apps every day out there. And how do we ensure that when public access into it, and they know that this is safe for them? And so with that, I think I'll just leave it for any questions. Thank you.
Thank you so much, Wengmoi. Before we jump into the panel discussion, just a quick reminder to our audience. Thank you, all of you who have been introducing yourselves and telling us where you're from. Please do post your questions in the chat, and I'll do my best to bring them into the conversation. We've obviously got an incredibly rich panel today, which we're very, very fortunate to have. So I'm going to need a little bit of help from my audience to make sure that I'm asking the questions that you want answered. But Chris, first and foremost, I want to turn to you because I think you raised a really important point, which I don't think people always understand in the context of digital health assessment and accreditation. You know, you referenced DTAC, for example, which is the UK and the NHS. But I think what's unique about the quality standards that you speak of is its focus on implementation. And I think that bridges in really well into what Brian was discussing as well. Are you able to talk a little bit more about those services that have been accredited and just give a bit of a sense of that journey that they've been on and what that process is?
Yeah, very, very happy to, Fiona. And look, I think the key point here that I made in that short presentation is that the standards are really geared towards assessing the organization at a whole and don't necessarily focus on the piece of technology itself. And while that's important, I think we need to consider the service in its entirety to understand how safe and high quality services can be delivered to consumers. In terms of the genesis of the standards, as I mentioned, the Australian government had a platform called Head to Health, which featured a number of these types of technology platforms, whether they were CBT or online peer support forums. And they really wanted to sort of wrap an assurance, a layer around those services to ensure that whatever they were funding and recommending to the Australian public was fit and safe for purpose. In terms of their focus on the implementation side of things, once services go through the process of accrediting themselves to those 59 individual actions within the standards, what the Australian government did, and one of the government agencies is the Commission on Safety and Quality in Healthcare, is really lent into the idea of supporting a suite of implementation resources. So we developed quite a lengthy guide to go through each of those actions and say, well, this one talks about privacy. So, what do you need to do in terms of ensuring that the data that you collect about a service user across their journey within a digital mental health service is kept safe and secure? Likewise, with the partnering with consumers standard, what types of systems and processes can you set up as an organization to ensure that you are effectively co-designing your services with the consumer, with carers and family members, and keeping those intentions at the core of the design principles within the service? We also went about developing a series of other implementation materials and suite of artifacts that were sort of focused around action guides or implementation guides. So sort of honing in on some of those key aspects like privacy, like data security, and also that partnering aspect to ensure that we sort of had a bit of a step-by-step or flow to ensuring that services could tangibly actually meet the requirements of such a high bar for safety and quality.
And in terms of like, if I was walking into an Australian service, for example, and I'm probably going to ask this question to each and every one of the panelists, but if I was walking into a digital mental or a mental health service, what kinds of tools would I be using or would I be signposted to?
Yeah. So there's quite a large span. I think the predominant method of delivering mental health care to Australian community through digital means is really online CBT. But we are seeing quite a few more AI-enabled technologies in the context of chatbot implementation. But likewise, those peer support or peer supported forums are really starting to gain a lot of traction. And we're also seeing a number of services that don't necessarily lean towards that mild to moderate type mental health category, but also starting to increase in terms of mental health complexity. So, Sane Australia is a really good example of that. They sort of pitch themselves towards the high complexity mental health conditions, so schizophrenia and other types. And I think it really does demonstrate that digital mental health services aren't just for the lower spectrum of, say, depression, generalized anxiety disorder, and others, that we really can utilize them. And then, as evidence to demonstrate this, that we really can utilize them for higher complexity mental health conditions. So, what I would say is there's a big span, likewise, GAD, depression, and also eating disorders, sleep disorders, those sorts of things. There's really a broad spectrum of types of mental health that Australian products can support with.
Thanks, Chris. And Brian, what about in China? Because I think what was really interesting in the example that you highlighted, or at least it seemed to me, was that it was a very wide range in terms of how you could access, and sort of also you had some really interesting comments about, again, about implementation. So it'd be great to understand what that practically means for an end user in China.
So I think at this point, there's been a lot of work done on what's called the Internet Hospital. So there's been a ton of digitalization efforts that have been led by hospital system here in China. Shanghai Jiao Tong University, I think, is a great example where it's not just mental health services that are being delivered online, but also other types of consultations and forms of consultations for other types of diseases as well. So I think what we're seeing is a lot of a promise in terms of the intervention, but in terms of evidence-based interventions for, let's say, like step by step for depression or other interventions, I think we're still at a moment where we're developing the evidence base, and there are trials that are going on to kind of look at this intervention. But like I said, in this study that we looked at, in terms of implementation, we only found one intervention that has maintained after the trial. So I think we're still at a moment where implementation and maintenance of interventions is really the challenge longer term.
Mm.
Yeah.
I'm just going to turn to the audience for a second. So, what are some of the ways that you've seen digital mental health products ensure safety, especially when many are developed outside of traditional clinical settings by non-mental health professionals? Are you able to speak to that, Brian?
So I think this question to me really gets into the standards of AI practice. What we're seeing among youth in particular is that they're using intervention that's not even been developed for that purpose. They're using AI conversationally to talk about their mental health challenges in a way that maybe older adults are not doing. I think that's actually something that we need to spend more time and attention on, and thinking about whether or not this kind of conversational agent that has not been built for the purpose of discussing mental health challenge and providing intervention is actually doing harm or doing good. And I think this is an empirical question. There's some sensationalistic stories about how AI has led to people dying by suicide, for example. So I know that we have a ethical and moral mandate to investigate this and to ensure that AI is safeguarding health and well-being and promoting it. But I think there's a lot of promise here as well, because as many times as you hear about these sensationalistic stories, you also hear a lot of use cases where people are using this in a way that has been helpful to them. So I think we're at a moment where we need to evaluate this and look at this very carefully, because people are already using it. So to me, this question really stimulates that direction to really analyze the usefulness and use case of AI, not from a digital mental health perspective, but just from a use case perspective. Yeah.
And Fiona, maybe if I could just build on that point, I think there oftentimes is a little bit of uncertainty about the effectiveness of digital mental health products among the clinicians that I work with on a day-to-day basis here in Australia. Whether it's privacy concerns or just a general low confidence in digital technologies. And to Brian's point, this sensationalism rather of artificial intelligence only compounds that issue. And I think we really need to sort of draw it back to that clear evidence, to that targeted cultural adaptation, and really working quite hard as policymakers to integrate into practice management systems to ensure that we're providing clinicians with the tools that they need to recommend to consumers, rather than relying on a GPT model that is not trained to provide the type of advice and evidence that you might expect from a skilled clinician.
I feel like that would be a good time to bring in Dr. Anne-Claire, thinking about some really good examples of best practice. I wondered if you could talk a little bit about how demographics influence patient engagement with digital mental health recommendations, but generally more usage as well, and some of the examples you've seen in the areas that you work around good examples of cultural adaptation.
Yeah, sure. But maybe to just go back to the point on like, we need more evidence. I think one of the challenge and talking from a global mental health perspective, right? Looking at like how like low and middle income countries have adopted like digital mental health solutions, that most of the like clinical trials, like research studies, they come from like either like high income countries or like tech advanced like countries, right? And I think we need also like more evidence coming from like low and middle income setting. That's something like we advocate for. So we need more maybe like collaboration between like high income settings and low and middle income settings to do this like study together. There are a few obviously, but I think we need more. And also to help understand those like implementation drivers, because in the region, in Asia Pacific, there are still like places where people don't have access to internet, so they can't like connect, they can't use the app on their smartphone. They have difficulty to access like telehealth services. So sometimes we forget, because we talk a lot about like AI and those like very like fancy and disruptive like technologies, but we still forget that there are places where people don't have access to these technologies. And very recently, I think quite a few like companies announced that they're expanding their strategy to also like offer like in-person therapies, right? So I think like digital mental health startup also realized that like technology is not necessarily the only solution, and we know like in terms of like demographic that like young people will be more likely to use like digital technology rather than like more like elderly people, because they are more like literate and digital savvy, right? So that's the income setting, where you come from, your age, your cultural determinants and social determinants, they play major role in your mental like for your mental health, but also like in how you use those services. And need to have more discussion around that.
Thank you, Anne-Claire. Clearly, it's a really interesting point, I think, when we talk about AI in mental health and access to data that informs some of these models to ensure due representation. How with your, Dubai has such an interesting population with people coming from all over the world. How has that factored and influenced your approach?
Thank you for your question. So one of the good things that we have in the UAE is that we have an integrated healthcare system. And you're right, the UAE represents people from all around the world. So we do have, like if we go to any place, any cafe, any shop, you'd see representations from all around the world. So it's like a little cohort that is in the UAE. And to cater and to serve different people with different needs can also be a challenge. So when I think one of the fundamental things when it comes to AI, I think it's just adding up to a little bit of what my colleagues have mentioned earlier, is to have that trust, a build of trust, so that people are able to use the AI, and the physicians who are using the AI are more likely to use it. The only way they do that is if they see an interest and they're shared in the risks and the assessment of it. So having more of the awareness of what AI can do, so that we can have more people to come on board. The advantage of having a lot of data that is connected there is to open doors for inference research and see if that AI works and if it's applicable to our region. So we do get a lot of applications that might work wonderfully in some parts of the world, but it might be a challenge in this part of the world. And if there are these biases that are in the app or in the application or in the platform, AI tends to amplify those further. And then it doesn't become representative, and then they're less likely to use it or less likely to adapt it. And one of the things that we do here is we don't just register apps and technologies. We actually assess them ethically and make sure that they work and they're applicable. And if it's something entirely new or it hasn't been done in the region, or maybe worked in some part of the world and not as, we always support a POC or an accelerator program where you actually test it and see if it works in the region. And with that massive data that we have, we are opening doors for seeing if this is going to work at the primary level to treat patients, and at the secondary level to see if that secondary data can be used for future health and treating future problems regards mental health or any other chronic conditions.
Thanks, Kalu. I'm conscious of time, and this has been sort of such a rich panel. But I just wanted to ask, Wenmoy, in Singapore, how has this work been received by clinicians? What has been their response? And when we talk about AI, do the clinicians get excited about its potential, or do they get nervous? And in which case, what sort of, we talked a lot about education, understanding AI and being able to critically engage with AI. What does that look like for a clinician?
Yeah, before I comment on that, I think maybe just to touch on the safety, right? I guess to me, and something that I also learned from Scotland just last week, is do no harm, whatever things we do. And digital does not mean that it has to be the fanciful apps, because in fact, a lot of times, when you want to do apps, you have to do a lot of marketing at the same time. So in fact, a simple telephone, sometimes it works, and especially for areas like including in Singapore, many of our old folks, right, may not be very highly educated. So when it comes to apps, they have a lot of concerns and they don't know how to maneuver. So sometimes as simple as just a telephone, and then with that, working with them. And the other part about when it comes to early on, you mentioned, so that also include AIs, right? First of all, I think to me, there are two types of AI application. One is generative, right? ChatGPT. And that one, I think most of our clinicians in Singapore, I think internationally, there's always concern, right? About, you have problem. And in fact, one of the psychiatrists from eMHIC has just wrote a paper, published in a newspaper just yesterday about how this generative AI can be quite dangerous. And they even, when his patients go into the ChatGPT and start chatting, and then the ChatGPT say, oh yeah, you can stop your medication for schizophrenia, So there is a lot of concerns in terms of that. But if you are talking about protocolized AI, that's another matter, right? So there is a certain limit and there is a certain structure, and there's a certain safety protocol in that as well. So I do see AI as something very promising, but we do need to ensure there's evidence and effectiveness in terms of that. And how do we safeguard that in terms of for our patients who may not have all the knowledge. That's why in Singapore, we're still exploring what is the different way in terms of us even ensuring there's clinical evidence, there's effectiveness in the use of the, whether it's AI or just digital mental health, from both technology and even data security, privacy standpoint as well. And so we're still working on those. So for our clinicians, I think generally, they're all excited about this new thing, right? But they are also fairly concerned about if we're to use generative AI. So at this juncture, most of our AI are protocolized or is used to kind of look into how they can support our clinician better in the way when they talk to their patients or look at some of the questions and things that come forward. Yeah.
Thank you, Wenmoy. So we are going to have to wrap up just because it's 10:28. For the couple of members of the audience who asked questions via the Q&A, what we will do is we will put them to our panel and we will get answers for you. So sorry that I didn't get round to them. But as we wrap up, I just wanted to say a huge thanks to our amazing panelists and to our wonderful audience. Today was a really important panel, and it was really incredible. As someone who used to work for the Organization for the Review of Care and Health Apps, this is close to my heart, and it's incredible to hear all of the different experiences from the APAC region, and of course in Dubai. And I loved what you said, Khalid, about mental wealth. It's one of the things I found most striking about learning about the Dubai mental health strategy earlier this year. So thank you to you all again for being part of this vital collaborative movement. Your contribution is invaluable, and we hope you'll keep supporting the transformation through our events. The eMHIC Congress 2025 is coming up on the 19th to 21st of November at the Western Harbour Castle in Toronto, Canada, with online access available if you can't be there in person. It's an exciting opportunity to connect with leaders from over 40 countries and across every sector, all in one place over 2.5 days. You'll hear about real-world digital mental health solutions, gain early insights into policies, AI innovation and best practices, and help shape global frameworks for mental health equity. It's really special, and the energy over the event is truly infectious. We'll drop a registration link in the chat if you'd like to learn more. And once again, thank you for being here. We hope to see you again for part 2 of this series coming up in October. Other webinars are happening in between, so do check those out on the eMHIC website. And as usual, I hope you have a wonderful rest of your day or evening wherever you are in the world. Thank you very, very much.